Salt is often called the heart of every dish. But for patients with hypertension, it's also the heart of many concerns. How much is too much? We all need to know. Let's turn to an expert for clarity regarding ideal salt intake for managing hypertension.
Hi, Ronit. Yes, salt is one of the important contributing factor in diet and BP control. Salt restriction should be there less than 5 gram per day. But guideline says those who are already diagnosed with hypertension or there is a strong family history, then the restriction should be less than 2 gram per day. Salt restriction helps to improve the elasticity of the arteries and tackle the blood pressure.
Thank you, doctor. Your expert advice will empower patients to strike the right balance, savor their meals, and successfully get to goal for healthier blood pressure. One of my relatives has high blood pressure, but tracks it diligently twice a day, keeping a record to stay in control. While some friends tease him, it raises the key question: how crucial is regular BP monitoring? And what's the best way to do it at home? Doctor, please, could you share your expert insights?
Home BP monitoring is one of the important methods to manage the blood hypertension nowadays. There are lots of digital apparatus available in the market, but I recommend proper technique should be there of measuring the blood pressure with BP apparatus. So people don't follow the proper instruction should be followed while measuring the blood pressure, and they get the false abnormal readings and they get panic. So it's very important to follow the proper techniques like tying the arm cuff, keeping the BP apparatus at proper height, don't move your body, keep your legs. All these are simple instruction that can be followed while measuring the BP with BP apparatus at home. You can record all your readings and you can share with your doctors at the time of follow-up. Home BP monitoring also helps to prejudge the complications prior to occurrence, and abnormal BP reading can be recorded.
Thank you, doctor, for clarifying this important topic. Your guidance inspires patients to take control and confidently get to goal with their blood pressure targets. Exercise is often called the best medicine, but is it the same for hypertensive patients too? If yes, which type of exercises are recommended and which are to be avoided? It's so confusing. Let's ask our experts for insights on the role of exercise in managing high blood pressure and whether there are specific types or durations of exercise recommended for better control.
Yes, this is, I think, the most important question lots of people ask me. There are two types of exercises. One is relaxing or resistance exercises like yoga, band exercises like strength, resistance to body and muscles. And the other type is strengthening exercises like weightlifting or making up the power of muscles. So the relaxing exercise will help you to tackle this over-sympathetic activity, which we can see the lots of youngsters nowadays. It also helps to tackle the stress-related blood pressure rise. The second part, that is the strengthening exercises, will help to improve the endurance of the heart. Endurance increase means ultimately the heart will be able to pump more blood with less efforts. So it will definitely help to tackle the blood pressure. So both the type of exercises, guideline says you should follow exercises for 5 days a week, and the duration per day should be ranging from 30 to 45 minutes a day. And exercise will help.
Thank you, doctor, for highlighting the critical role of exercise in managing hypertension. Your advice will help patients incorporate the right physical activities into their routines and stay on track to get to goal with their blood pressure targets.